So we'll call this Grey County
So,
Long-Term Care. Sorry, go ahead,
so
Rob.
sorry, I just got to get the recording going here too.
Okay, sorry.
All good. Thank you.
All right, thank you, Rob. It is 9 o'clock. We'll call this Grey County Long-Term Care Committee of Management meeting to order. I'd like to welcome everyone to today's meeting. And with that, I will just remind members of the committee to declare a pecuniary interest or an interest. Not seeing anything. If anything should arise, you may declare it at that time. Our first item for direction or discussion is the long-term care CM 13-25, the long-term care director's update from July the 1st to August 31st. Can I have a mover, please, to get that on the floor? Moved by Councillor Hutchison, seconded by Councillor Carlton. And we'll turn it over to you, Jennifer.
Thank you very much. Good morning, Committee of Management. Thank you, Mr. Chair. Before I get into the report, though, I would just like to take a moment to introduce a new face to the meeting. And I'd like to introduce and welcome Terry Fisher. So Terry, if you can give a little wave. Terry is the new Executive Director at Rockwood Terrace. And I do have a little bit of information about her in the director's update, but I think I'll share it now. So Terry brings over 34 years of dedicated service with the County of Grey, consistently demonstrating exceptional leadership, collaboration, and a deep commitment to our vision and philosophy of care. Her background in gerontology and the completion of the CHA Long-Term Care Executive Leadership course have equipped her with the expertise and vision to lead Rockwood Terrace into its next chapter. So welcome to the team, Terry.
Thank you, Jen, for that warm welcome, and good morning, Committee of Management.
Good morning, Terry. Welcome to the Committee of Management. And you've got good mentor there with Karen. So welcome to the team.
I do. Thank you.
All right, thank you for that. And so now I will just share an update of items that have happened over since the last time we met. So some significant ministry updates. On July 23rd, the Ministry of Long-Term Care introduced the new 2025 Capital Funding Program, so the CFP program, part of their continued efforts to expand long-term care bed capacity, streamline development process across the province. The CFP aims to more effectively address regional variation in construction costs, provide greater flexibility and responsive financial support, and address the needs of various operator types across the province. Staff advocated during AMO in August to ensure ongoing capital projects such as Rockwood would be considered under this new funding program. Further correspondence was provided by the ministry on August 27th, asking organizations to complete a survey by September 29th to outline any plans to advance capital projects based on bed allocations previously issued by the Ministry of Long-Term Care. An information session regarding the new CFP and the survey requirements was held on September 11th, which county staff attended. It was confirmed through that information session that projects that have already entered into a development agreement with the province under a previous funding program, like Rockwood Terrace, would not be eligible for the new CFP. Therefore, the province is looking for an update on any plans regarding the other bed allocation, the 62 beds that are associated with the potential redevelopment of Grey Gables. In order to respond to the survey, staff will be preparing a report for the September 25th Committee of the Whole meeting to seek Council's direction regarding whether Grey counties start to plan for the use of the existing bed allocation or whether this be released. So that report will be coming next week. On August 18th, Ontario Health West released information regarding the proposals for this round of local priority funds. This funding stream is designed to support long-term care homes by providing assistance for initiatives such as the acquisition of diagnostic equipment, staff training, specialized equipment, and services that align with the local priority criteria. The goal is to support the specialized needs of existing and incoming residents to prevent unnecessary hospitalization and enable better patient flow from hospitals to long-term care. Eligibility details are linked there, and all 3 homes have submitted proposals for items such as IV training and equipment, bariatric lift equipment, skin and wound care supplies. What is kind of unique about the Local Priority Fund is that it's designed to be flexible so that it isn't, for example, just funding for lift equipment. It's funding that homes can apply for based on the needs of the residents, the challenges that they're facing, resource challenges, equipment challenges, training challenges. So all 3 homes have taken an opportunity to apply for that funding. On August 20th, the ministry shared a letter announcing the allocation of up to $102 million in funding for the Comprehensive Minor Capital Fund. This funding is intended to support long-term care homes in maintaining physical infrastructure facilities, supporting minor capital improvements that directly enhance infection prevention and control practices, reducing the incidence of falls and fall-related injuries, and promoting increased mobility and overall well-being for long-term care residents. And this is another effort of the province to bundle together smaller streams of funding and created one called the Comprehensive Minor Capital. Under finance staff in partnership with leadership of the long-term care homes have reviewed spending as of June 30th and prepared a projection based on trends versus budget. As of June 30th, the allocated funds are deemed sufficient to effectively operate the homes, both operationally and in capital areas, and the impact of in-year funding increases will be reviewed at future committee meetings. We do continue to work closely with staff from finance, human resources, and purchasing to monitor our variances and ensure that we are taking a fiscally responsible approach. Family updates. There was a virtual family meeting held on July 2nd and included recent updates and representatives from our new pharmacy provider, Silver Fox. The next family meeting is scheduled to be held October 8th and will feature updates around fall preparedness. We'll have a Silver Fox update and any Ministry of Long-Term Care updates and a discussion about the resident and family satisfaction surveys. Those surveys are going to be released shortly, and we really encourage residents and families, as many as possible, to complete those surveys. Rob and I had a little chat about our virtual family meetings. We do them live, and we offer a Q&A opportunity. We don't get as many people attending the live session, but we still have up to 100 views of the video recording of the meeting after. So people are seemingly still interested in getting that information. They just watch it at their own convenience. Infection prevention and control. On August 15th, the Ministry of Health released a memo, which is linked here, and a fact sheet to support planning for the upcoming respiratory season. The communication emphasized the continued importance of vaccination against both influenza and COVID-19, with these measures being critical for protecting individual health, communities, and the impact of on the healthcare system. There were details regarding RSV, because I'm not attempting that one, and those are anticipated to be released shortly. The homes are actively preparing for our annual influenza and COVID vaccine clinics that will be scheduled in the fall. Vaccines will be available for those unable to attend the clinics, and we continue to encourage everyone to boost their immunity. So we do everything that we can to make it as easy as possible for our team members and residents to get their vaccinations. Staff and training, we continue to recruit for registered nurses, registered practical nurses, personal support workers, and food service workers. We continue to work with new student placement opportunities with colleges that are local and in our surrounding area. On July 3rd, Advantage Ontario, our association that we are members of, distributed a survey to gather input for ongoing advocacy related to the PSW Authority and legacy PSW legislation. This initiative responds to the amendments in the regulations under the Act, and the goal is to better understand how many PSWs are currently working under the legacy provision, having completed their education before July 1st, 2014, and to assess any potential impacts that the regulatory changes may have on staffing and service delivery in long-term care. All three of our homes have gathered that data and submitted our responses. On August 27th, Warden Matrasovs, CAO Schertzer, Deputy CAO Lobley, and I had a chance to get out to all three of the homes and have a tour, meet with team members, meet with residents. These visits provided an opportunity to engage and see some of the day-to-day operations and activities, and it was a really great day.
Jen, could I just stop you there for a second? Yeah. I see the warden smiling, so I'd just like to give Warden Matrasovs and Deputy CAO Lobley an opportunity to just their takeaways from the firsthand visit that they had. So please, Warden, go ahead. And sorry
Thank
to put
you, Chair.
Sorry to put you on the spot.
No, thank you. I'm glad you.
But go ahead, Warden.
I'm glad you've offered the opportunity, because one of the things that we really appreciated is at each of the three locations, we saw a different operational side. So at one place we visited the laundry, and it's just amazing when you see what happens on the scale that it happens in that institution to make sure that every resident knows that their possessions are going to be looked after and returned safely to them. It's amazing the commitment that goes behind it, that the staff provides to make sure that happens, and the kind of technology. And then another visit, we went into the kitchen, for example. So it was really helpful. And I think that was a great way to do it, that we had a chance to see all three facilities, but we focused on one particular operational side at each one. So always it's like a picture is worth 1,000 words. When you're actually there watching it, talking to the individuals that work there and how it all works, it really illustrates what we often have to read about in a report on paper. So thank you, Chair.
Thank you, Warden. Now, go ahead, please.
Yeah, no, thank you very much, Chair, for the opportunity. So I would build entirely on what the Warden's comments are. The thing I think that impresses me every single time I go into each one of these homes is just how much of a home they really are. It's sometimes challenging to imagine a situation where you have nurses and personal support workers, cooks and laundry staff manning the building or personing the building, to imagine that can feel like a home. And every single one of our three homes feels like a home, and perhaps more specifically than every single one feeling like a home, each home area feels like a home into its own right. There's small communities within the community of our long-term care homes. And so for me, you know, the passion of the staff really came through. The opportunity to connect with them and see them doing their work is incredible. And the proof of that is in the fact that each one of these spaces feels genuinely like a home. They feel alive, they feel creative, they feel full of people living their best lives. And it really is quite impressive to be able to pop my head round. And I'm always happy to be at Lee Manor. So I'm not setting down the gauntlet or anything else like that for the other two, but there's always Werther's Originals in Talene's office. So I'm always happy to go to Lee Manor.
Well, thank you, Niall, and thank you, Warden. And certainly it's confirmation of what I think most of or all of the committee members already knew. It's I agree. Some of the tours that I've had, and I remember being in the laundry at Rockwood, and I was amazed at the amount of linens that they go through, but the personal touches that they take. And I remember the one staff, I think she'd been with the county, she had retired and was back on part-time because she said it's part of her family. And so anyways, it's great. And the sense that you get when you're in any of our long-term care facilities, it does feel like a home, and certainly proud of all the work that our staff do. So sorry, Jen, we'll let you get back because I know Councillor Patterson wants us to be tardy, and so we'll continue on.
Thank you for that. I feel like that should be the end of my report is what I think, but let's see what else there is in here. Yeah. And thank you for your comments. I am always so proud to be able to be part of tours at the homes. I feel exactly how the warden and Deputy CAO Lobley have described it. So I appreciate your comments, and we'll make sure that the team members at the homes hear that as well, because I think that's really important.
Thank you.
We are really pleased to update some team member additions, and so we welcomed Nicole Bertrand in the role of RI coordinator at Grey Gables. In this position, Nicole will support the delivery of high quality care by helping to ensure accuracy in the resident assessment instrument, which is the RI program, in alignment with the ministry guidelines. Nicole will be instrumental in supporting the transition to the new Inter-RI long-term care facilities assessment instrument that Grey Gables will be going live with in January. Pleased to welcome Terry, and I'm glad that I had a chance to do that at the beginning of the meeting. Grey County Long-Term Care, in collaboration with the Center for Learning, Research and Innovation, CLRI, and their PSW fund and Plum Tree Memory Care will be offering, we did offer an education session on September 10th for staff from Grey and Bruce counties. The Better Together Dementia Care training delivered by Plum Tree will focus on equipping staff with practical skills supporting individuals with dementia. And that was open not just to our 3 homes, but to all of the long-term care homes in Grey and Bruce County. And we're really pleased to be able to be part of offering that. In addition, facilitators from CLRI will be hosting 2 courses, Living the Dementia Journey and One Day on October 28th and 29th. These sessions are designed to support team member growth and development. They will be offered in person at the Sydenham campus and are supported through the PSW fund, which provides backfill reimbursement for attending team members. We really value these partnerships and look forward to continuing opportunities for collaboration. And I should look at Shannon and I know Grey Gables residents and team members are featured in at least the One Day videos and content of that training, and possibly also in the Living the Dementia Journey videos and training materials. So it's pretty cool. The Association of Municipalities of Ontario conference was held during this reporting period, and during the event, the delegation met with the Honorable Minister Natalia Kusendova-Bashta, the Minister of Long-Term Care. We had the opportunity to express appreciation to the Minister for her attention to concerns regarding timelines for the Vulnerable Sector Screening Program and the PSW certification program. Advocacy efforts also included a request for continued support for the care support assistance in long-term care, that those individuals that work alongside PSWs to enhance resident care. Additionally, we were pleased to provide the Minister with an update on the redevelopment of Rockwood Terrace, and the delegation group was made up of MPP Paul Vickers, Warden Matrasovs, Deputy Warden Milne, LTC Committee of Management Chair Mackey, CAO Schertzer, Deputy CAO Lobley, and myself. And it was a really interesting and exciting opportunity to be a part of it, and I was pleased to be able to be a part of it. Wellness continues to be something that we pay close attention to for our team members, and the 3rd quarter of the staff wellness newsletter will be released at the end of September. And just a reminder that this newsletter goes out quarterly, and it promotes our employee assistance program, wellness tips and resources, color it spirit photos, color it stories, the CLRI's diversity and inclusion calendar, some IPAC tips. We take it as an opportunity to review the emergency codes and provide updates from each home. And with partnerships, we're always looking for opportunities to partner and collaborate, and are grateful for those opportunities. And that is my report. Mr. Chair, thank you.
Thank you, Jen. Very good report as always, and I will open it up for questions from committee members. I am not seeing anything, so I will call the question. Sorry, Deputy CEO, go ahead, please. You're muted. Yep.
I think I fixed that one. Thank you, Chair Mackey. So I'm not going to add any question because obviously I am not a member of the committee. I am staff. But I just will briefly expand on one of the points that Director Cornell touched on at the start of her report, which is in regards to the survey around the 62 beds. So as Director Cornell indicated, that will be coming back to Committee of the Whole and Council. Our typical process would be to bring a report of that nature back before this committee prior to it going to Committee of the Whole or Council to seek your endorsement and recommendation on staff's approaches. And so I think on behalf of the team here, our apologies that we're not able to do that. The timelines that the province have established are just incredibly tight on this one. And so we simply did not have enough time to get information prepared in advance of the agenda setting process for this. We are well on the way to writing the report for Committee of the Whole and Council. There's still a few things outstanding to pull information together on that one, but the timelines are quite short. So as noted, the question and answer session with the province was just a week ago. And the deadline for submitting the survey that is noted in the report is September the 29th. So we are moving very, very quickly. And indeed, we will be looking for direction from Committee as a whole and Council endorsement to be able to submit that survey in time to meet the province's fairly tight deadlines. I am able to share very briefly the deadlines that follow on from that. Which would necessitate a re-agreement with the province for this 62 beds and what we were going to do with those 62 beds before March of 2026. And if we are going to maintain that 62 bed allocation, the province at this time has an ambition construction schedule of shovels in the ground no later than March 2028. And so there are some fairly ambitious timelines associated to this. I'm sure that the team or myself are more than happy to take any questions there might be in regards to that. But as I say, we apologize that the normal process of bringing that through this committee cycle before heading to Committee of the Whole cannot be done in this particular instance. It would just have no time to do that. The province is working very, very quickly.
Thank you for that update. And I'm sure that will be a good discussion at our Committee of the Whole meeting. So thank you. All right. If I'm not seeing anything else, I'll call the question. All in favor of receiving the director's report? And that is carried. Thank you. We now have the LTC CM 1425 long-term care operational report dated June 15th to the August 14th be received for information. Can I have a mover, please? Moved by Warden Matrasoft and seconded by Councillor Carleton. And Jen, are you starting at this report or?
I am. Thank you, Mr.
All right.
Chair. So this report is our operational report covering the period of June 15th to August 14th. And I am going to kick us off with the quality section. And as you will recall from previous discussions, that these indicator numbers are released quarterly and are based on our CIHI data that comes from the current Inter-RAI program. And as I mentioned in the director's update, we are in a year of transition from Inter-RAI to the Oh no, I've got it wrong. Sorry. This is based on the RIE program, and the transition is from RIE program to inter-RIE, because those titles are so different from each other. So apologies for the confusion, but we're in this year of transition. Lee Manor has launched the new program first. They went live in July, and Grey Gables and Rockwood Terrace will be going live in January, which means they will be gearing up for the training and rollout in the next few weeks. So that's one piece of what's happening here. The other piece is that we had a really in-depth discussion about the indicators and the approaches to documentation and tracking back at a meeting in November, where we talked about looking for opportunities with how Rockwood Terrace approaches the data and the documentation and their interventions and programs, and how that may be the same or different from Grey Gables and Lee Manor. And so we've been actively doing that work. It's a little bit disrupted because of the transition that's happening, because we're actually now no longer looking at apples and apples. And so that will stall that work while we fully invest all of our energy into the transition to the new program. All of that to say, these kinds of indicators and data take time to demonstrate and reflect change. They are not overnight changes. They are changes that take place over time. So I do want to just share some of the interventions that the homes are working on. So Grey Gables has highlighted a couple of areas in the report. Elevated mood-related indicators are primarily linked to the individuals that are living in our behavioral support transition unit. We have responded with person-centered care plans, team member training, structured routines, and meaningful activities to support residents experiencing symptoms of depression. For residents that are prescribed antipsychotics without a diagnosis of psychosis, which are often initiated in hospital or clinical settings, we follow clear guidelines to ensure clinical justification and conduct regular multidisciplinary reviews to reassess medication needs. And just even in that example, and I'm not a nurse, so if I get something wrong, the nurses on the call could help me out. But these are not, medications are not things that we also change overnight just like this. It takes time. There needs to be full assessment. There needs to be a review of it, engagement with the physician, with the nurses, with the pharmacy. Those are all really key pieces to make sure that we're getting it right. And each resident is different as well, right? So we're getting it right for each resident.
Yeah, and just
Yep.
quickly, with our nurse practitioners now, will there be an assistance in a more timely change to medications if it's deemed appropriate?
Yeah, through you, Mr. Chair, and I do. So yes, I was remiss to leave out the nurse practitioners. Those folks are playing a key role in bringing another layer of expertise to this discussion. So I want to just clarify, it's really not about a delay in medication changes. It's about making sure the medication change is the right change. And that takes a full assessment and discussions and making sure the right people are assessing and weighing in on that.
Thank you.
To reduce falls, we develop personalized prevention plans, address environmental risks, review medications, promote exercise and safe mobility. Pressure ulcer prevention includes daily skin assessment, repositioning, nutritional support, team member education, technology, such as skin and wound applications. While we report no daily restraint use, pain management remains a key focus. We use best practice screening tools and conduct daily assessments, applying both pharmacological and non-pharmacological approaches. Team members are trained to recognize signs of pain and care strategies, are guided by resident preference. So that's just to give you an example of the focus at Grey Gables. Lee Manor, worsened mood from symptoms of depression and taken antipsychotics without a diagnosis of psychosis has improved in the last quarter. Changes in resident acuity and occupancy has presented challenges in 2025. Fall prevention strategies include individualized assessments and goal setting, physiotherapy, restorative services, and reviewing risk with team huddles. Team members focus on skin and wound care through audits, mentoring, education, nutrition, hydration, positioning, and best practice treatments. This year, the implementation of a documentation app assists with accurate measurement and assessments of wounds. Pain assessments are completed using the RNAO clinical pathways, ensuring best practices are followed, including practitioner referrals and both the pharmacological and non-pharmacological approaches. As we just discussed, Lee Manor transitioned to the new Inter-RAI process, which introduces changes to data collection and reporting methodologies. Until all long-term care homes across the province adopt the new assessment framework, which is anticipated in January, direct comparison between facilities will be limited and may not yield accurate or consistent insights. And in fact, Tallene is attending a training education webinar tomorrow about the reporting and the information that will be able to be gleaned through the new program. So we're still figuring it out and still learning about it. Rockwood Terrace, all publicly reported indicators meet or exceed the provincial average, and we were able to reduce worsened stage 2 to 4 pressure ulcers by 0.2% from the previous quarter. So that is the discussion on quality that I have to share. If there's any other questions, happy to take them. And if not, Dana is going to take the next section for clinical update.
All right, well, maybe just pause there for a minute, Jen. Is there any questions for that Jen's portion of that report? If I could, Jen, the chair has one question just in regards of the transitioning out of the behavioral support unit. There had been delays after people had been stabilized. I'm just wondering if there's been any improvement in that regard.
Through you, Mr. Chair, no improvement at the 30,000 foot level in terms of any changes with legislation or the prioritization of individuals on a wait list who are looking to move to traditional long-term care. That hasn't changed. Although I did hear through Advantage Ontario that the pilot for cultural specific admissions is going to be launching shortly. And while it's focused on admissions into culturally specific homes, I do think that the next stage of that is supporting faster transitions out of other specialized units. So the focus is about cultural, linguistic, spiritual specific homes, but the principle will apply in the same way. So that's on the horizon. We have had 2 residents, Shannon, I'll maybe pass it to you. We have had 2 residents successfully transition to traditional long-term care in the last 6 months or so, right?
We've had 3 in total, but 1 came to our own home areas,
Okay.
And then 2 into other long-term care homes. So yes, they've both been successful. We do have 8 more ready to transition out right now, but we're just in that waiting pattern.
So we're getting there.
Thank you. So did you say that Dana is stepping in? Morning, Dana. Go ahead, please.
Good morning. Good morning, committee, and through you, Mr. Chair. I am very excited, and I'll be honest, a bit relieved that July is over with, but that I want to share with you that we successfully transitioned to Silver Fox Pharmacy. It was a comprehensive 4-phase change management project. Through the transition, we prioritized our resident safety, the continuity of care, and we wanted it to be a smooth experience for residents, families, and the team. And to be honest, I've been doing this a while. it was no small feat. And in my career, I would suggest it's probably the biggest change management process that I've ever experienced, with the shortest pivot. So if you can imagine, we off-boarded one pharmacy at midnight and we had a new one at 12:01. Right, or within, or sorry, yeah, 0001. So as medication transitions, like you just don't mess with it. So it was quite a feat, but that was done through an incredible amount of planning. So I just want to review the 4 phases. The first, I mean, this was post RFP and post surveys and post assessment, what we wanted in a pharmacy. So as we went to the rollout, the preparation, we developed a detailed roadmap, from policies to align with the new pharmacy and our regulatory requirements. We made sure every detail was accounted for. We provided a cross-disciplinary team training, including all of our those invested, from our medical directors, all prescribers, all of our registered staff, dietitians, respiratory therapists, everybody had to be on board, from that preparation and planning. Then we had communication and engagement of everybody. We informed, as Jen shared with our town hall, families, powers of attorneys about the transition and the billing changes, because this is quite a big comprehensive program in our long-term care homes. And we had to be about transparency and including all personal calls to families. Like that was quite significant to have a conversation about the transition, and our staff, and you know what worked, what they're looking forward to, and all of those communication elements. We did education and training. We delivered the training on the new policies from the old pharmacy to the new, identifying what has changed, and medication ordering processes. We introduced a new, and I think I've shared this before, but the Scriberly digital platform to streamline electronic prescribing and improving accuracy, and our prescribers can make changes wherever they are. And so the timeliness and responsiveness for our residents. And we rolled out new equipment. Literally, we rolled out new med carts, scanners, computers, TV systems, and the nursing staff who use these tools are the ones that helped us pick out the ones that would work for them. We gave them choice and that engagement. And we've set up ongoing support for troubleshooting and adjustment. But I really want to say, you know, the dedication, the commitment of the leaders and everybody on board was quite incredible. The staff commitment in July to do an extra time because of all of the other commitments. So I think we were successful because of thorough preparation, because of clear communication, all of the updates, and also, again, just as you share, that teamwork and collaboration to ensuring registered staff wanted to make sure they saw in the new record, the new charting, that you know, so-and-so definitely needs putting in applesauce between that, or preferences, like it, just that level of detail and commitment from those team members, making sure every item was ensured. And so I think we're really positioned now for improved clinical support, some streamlined processes. That's what we asked for in the RFP, and enhanced pharmacy service delivery, because our residents and families deserve it, and so do our team members. So I think we're really set up for that commitment. And again, man, that was quite a change management process, but I'm incredibly proud.
Thanks, Jenna. Congratulations on a job well done. Jen, I guess I'll look to you to how you're going to direct us through this report.
Sure. Thank you, Mr. Chair. Karen is going to take the next section.
Good morning, Karen.
Good morning, committee, and through you, Mr. Chair. I'm just going to provide a little update on ministry compliance. So ministry inspectors have been in 2 of the 3 homes during the reporting period. They attended Lee Manor to do some follow-ups on critical incidents, and through that process, completed inspection protocols for medication management, infection prevention and control, and prevention of abuse and neglect. There were written notifications received related to infection prevention and control, and police notification that would be related to the prevention of abuse situation. Those items have been since corrected. Corrective actions have been implemented, and the report is linked there for your review. At Rockwood Terrace, we received the public report from our proactive compliance inspection. We discussed that in detail at our previous meeting, but the report now is attached for your review. And coincidentally, they are back in our home as of yesterday to follow up on the order that was left during that report. So hopefully we can get that cleared with their visit. They also visited early in July to conduct a critical incident inspection and completed inspection protocols for infection prevention and control, pain management, and falls prevention and management. And there were no issues of non-compliance from that visit. A couple things to update related to that. The inspector advised Terry and I yesterday that infection prevention and control will no longer be an automatic inspection with every visit. It has been that way since COVID, but that will not become automatic in future inspections and will only be completed if it's triggered. So if they're following up on a critical incident related to outbreak, for example, they would do that protocol, but not automatically with other visits. And the list of critical incidents submitted during the reporting period are there. I'd also like to just note that the ministry is very up to date currently on review of these critical incidents, where in the not so distant past, they might have attended today to follow up on CIs from even the previous year. We're seeing pretty immediate follow-up, like within a couple weeks even. So I would say they're right up to date with their inspection mandate. And that's it for me, unless there are questions.
Thank you, Karen. I'll look to committee members if there's any specific questions. Not seeing anything. Thank you,
And
Karen.
if not, Tallene is going to be speaking next.
All right. We'll turn it over to Tallene. Good morning.
Good morning, committee, and through you, Mr. Chair. So I just wanted to chat for a couple of minutes just about occupancy. So you might recall a couple of reports ago that for Lee Manor, we had talked about the occupancy being below the 97% threshold. So 97% threshold for occupancy under the regulations means we get funded at 100%. If you're below 97%, you would be funded at your actuals. So Lee Manor was a little bit at risk earlier this year. We were below the 97%. So we made sure committee was aware of that. We focused really hard on making sure that our processes were very timely and on point. And I'm pleased to say at this point in time, we have squeaked over the 97% for our year-to-date percentage. So just 97.29%. And I will also comment that that's based on our actuals right now. When we have outbreaks, we're able to apply to the ministry for some consideration of not counting beds that might be in a outbreak situation, but I don't know for sure whether they'll approve those requests. So this is our actuals without having to account for the outbreak beds earlier this year. So I just wanted to share with committee that that's where we're sitting for occupancy with Lee Manor, and certainly I appreciate the work my team has done to make sure we're on top of things. And I do just want to point out, you might look at the numbers there and see that our discharges at Lee Manor this year is 54, and we're not done the year yet for 151 bed homes. So it just speaks to the acuity of residents and how complex people are, and the work involved in the admission process in long-term care is massively high. There's a lot of work, and so we've done 54 admissions so far this year, which is a tremendous amount of effort and acclimatization and supporting residents and families with the stress of that move in, and all of the paperwork. I hate to say that goes along with that, but it is an overwhelming experience for residents and families, and the staff are really committed to supporting people through that. So just highlight that, we've supported 54 people so far this year with that transition. So I just wanted to share that, if that's okay. I also was I was going to also talk a little bit about emergency management stuff. I'll pause there if there's any questions before I move on to the other piece.
Any questions from committee members? Continue on, Pauline.
Okay, thanks. Jen asked me to talk about the emergency management component. So our process in long-term care is that we do have to, as we've talked about many times, we do have to test our emergency plan every year. So we have a whole series of codes that we highlight for committee on each report, code green and code red and code gray and all of the different codes. And so we have to test those every year, and we work really hard at doing that. So every month we focus on a different code. This quarter for this reporting period, we focused on code green and code brown, which we practiced. I also wanted to highlight code gray at this time because we actually at Lee Manor did actually do a code gray for real related to the construction out here by the county building and Lee Manor. So we did have the opportunity, I'm going to use that word because it was a good opportunity, to practice what it would be like if we didn't have any water. So the town needed to turn the water off to change the valve or whatever it is underground. And so we had to plan, and it takes a lot of planning, as you can imagine, to make sure we have enough water for an extended period of time for bathing and food consumption and cooking and drinking and toilets for 151 people and the staff who are also supporting them. So a lot of planning went into that. I really appreciate the support we received from the City of Owen Sound. They were fabulous in helping support us with what's it called, a comfort station. So we had a comfort station out at the back for the staff for toilets that did have running water, so staff had access to be able to use the washroom during that period of time. This planned event, we weren't sure how long it was going to be, but we anticipated it was going to be about 6 hours or more. So it was just under the 6 hours. We are required to report to the ministry if we have any of these events that go longer than 6 hours. So we were just under the wire, so we didn't have to do a critical incident about it, but it did allow us an opportunity to do some really good practice. Planning for drinking water for residents, what are we going to do about bathing, how do we adjust laundry, all of those types of things. So the team did a great job. I think it went fairly seamlessly. It was a good experience. So we actually did practice a code break for real. So I just wanted to share that story as well. And the other thing I would just verbally like to update committee about is it will be in the next report, but as I said, we have to test our codes annually, but we also have to practice a full evacuation. I believe the regulations say every 3 years. So Lee Manor is practicing our full evacuation in 2 weeks. So October 1st, we will be actually doing our practice evacuation. I'm meeting with Family Council today to let them know what's going on with that, meeting with the residents next week, putting all the plans into place to actually practice the big event. So that is happening in a couple of weeks. So I just wanted to let people know about that. And I think that was what I wanted to share. If I've missed anything, staff, let me know, and open for questions.
Thank you, Tolene. Any questions from committee members? Just one question, Tolene, and I think you were there yesterday, and I know Shannon was. For other committee members, I was at an emergency management meeting yesterday where the city of Orillia presented their ice storm, and you know, through that process, I was thinking about our long-term care facilities, and I know we've had situations where staff haven't been able to get in when the roads were closed for snow for, you know, maybe a 36-hour period. But I'm just wondering what we have as far as preparedness in the event of something significant like they experienced in Orillia. What would we do from a staffing perspective as far as having enough people to look after our residents, I guess, is the question. And I'm not sure who wants to. Jen?
I don't mind starting. Thanks through you, Mr. Chair. hopefully Mother Nature doesn't see this conversation as a challenge. But so we would do what we do in those 36-hour examples and just, keep doing that essentially. But what we've done in the past and what we have policies for, and even, I can't remember whether it was last year or the year before. So we are very fortunate to have support from our human resources partners, from our partners in transportation and paramedic services. So we have fan out lists, for example, and ways to reach our team members geographically. So we start with people that live closest. What we've seen in those examples of, over 2 or 3 days is team members that live within walking distance of the long-term care home opening their homes to support team members who have been kind of stuck so that people can have a chance to rest. We have had, if we have any rooms that are empty, we are able to set them up so that team members can sleep over. If we're in Owen Sound, there are hotels nearby, and we've set up opportunities for team members to stay in hotels. We have a number of days of, we're legislatively required to have a number of days of food and medication and supplies on hand. So we would have that. We have contingency plans set up with all of our agreements and contracted providers and vendors. So we're able to reach out to our partners that provide physiotherapy and rehab services. Are their staff able to help? During the pandemic, we had a number of team members from other departments in the county that did training and were redeployed into our long-term care homes to support. So I feel confident that we have a broad range of opportunities of humans and resources to be able to bring in support. We also, in Grey Bruce, with the long-term care group, have a long-standing agreement and a spreadsheet that is kept up. It's updated twice a year, and it's where the long-term care homes, all of them in Grey Bruce, document and commit to how many individuals they could support in an evacuation, what kind of supplies, beds, mattresses, that kind of thing. Do they have staff that they could support? And so depending on what kind of an emergency it was and how many long-term care homes in the county were affected, there's opportunity for shared resources across operators as well. And so we have that agreement in place. That's just off kind of the top of my head. I'm always so glad that we do these annual emergency exercises and training every year through the county. And sometimes the scenario thinks that it isn't going to impact long-term care, and almost always the scenario impacts long-term care. If it's any sort of environmental anything, and there's a long-term care home in the vicinity, it will impact, or with even within 20 minutes, 30 minutes away, because the people that work in the home live in that area. So it almost always impacts long-term care. So we always take that exercise as an opportunity to look at our policies, think it through. Where are our gaps? Where are our opportunities? And try to make those adjustments.
Thanks, Jen. I knew you'd be prepared, but I just wanted to hear it. So thank you.
Yeah, thank you. And Shannon is going to take the last section.
Perfect. Good morning, committee. Through you, Mr. Chair. During this reporting period, resident councils convened at all 3 long-term care homes. Each meeting was attended by the respective executive directors who shared updates on key initiatives underway at each home. Topics included the redevelopment project at Rockwood Terrace, the pharmacy transition, and the various capital projects. At Grey Gables, the Family Council did not meet over the summer months, but however, there were meetings held at Lee Manor and Rockwood Terrace, where discussions focused on infection prevention and control, redevelopment plans, and ongoing renovations. And one of our Color It stories is from this reporting period is from Rockwood Terrace, where a vibrant social event was hosted featuring the Durham Red Hat Chicks. The gathering welcomed 11 members from Durham, 3 from Owen Sound, and 2 of Rockwood Terrace's residents, creating a warm and lively atmosphere for connection and camaraderie. Several spouses of the Red Hat Chicks generously supported the event by helping out to set up displays, decorate the venue, capture memorable moments through photography. Guests and residents enjoyed a delightful spread of desserts, cheeses, crackers, and more that was all provided by the Chicks. Adding to the festive spirit, the group brought an assortment of red hats and fascinators, allowing Rockwood residents to feel like honorary members for the afternoon. It was a joyful celebration and a wonderful example of how to color it for the community. Thank you.
Thank you, Shannon. Any questions for Shannon? Not seeing anything. Thank you again. So if that is the end of the reports, Jen, final chance for questions from members of the committee. All right. Can I have, I guess we'll call the question, all in favor of receiving that report? And that is carried. And if there is nothing else, is there anything under other business, Jen? No? I guess I will look for a motion to adjourn, and I hope I've done this quickly enough. Sue. Moved by Sue and seconded by Shirley. All in favor of adjourning? That is carried. Thank you, everyone. Enjoy the fall weather.
Thank you. Have a great day.